This is Howard Wolinsky for Active Surveillance Patients International, ASPI, and we have a very special guest today, Ifor Thomas, a poet from Wales originally, who is very unusual. He may be the poet laureate of prostate cancer. He wrote there are many prostate memoirs where men are telling their sad stories of what happened to them. There are many books by doctors telling us what they're going to do to us. But Ifor, I think, is unique because he has the poet's vision, and they say poets can tell the future. We'll see. We'll see. We're going to ask a lot about the past.
I'm not sure about that.
And no, you'll be great. And yeah, but let me start off and ask you a couple of things. I know what a slam poet
Yes, please do.
is.
Please do. I'd just like to say I'm very pleased to be here, and it's great to meet you, you three stalwarts of the prostate scene.
We're the three musketeers of active surveillance, I guess.
Well, there are four of them originally.
Well, that's a long story. We're not going to.
Yeah, we'll skip that one. We'll skip that one.
We're going to go. We're not going to get into politics, but I know what a slam poet is. I used to work with one, and that's sort of like rap, and they have wars. But what's a performance poet? Are you dressed? Do you wear clothing?
Well, I mean, it's a pretty broad category we're looking at here. Generally speaking, it's a poet who essentially believes that poetry should be spoken first and perhaps read afterwards. The delivery is important. I worked with a number of performance poets in Cardiff, in Wales, and props were quite important. I would use a chainsaw on stage. I'd be wrapped in cling film. My friend would have a rubber chicken. The idea was to Peter Finch, he's quite a celebrated poet. The idea would be to, I mean, it was Dylan Thomas, really, another Welshman, who sort of became something of a performance poet. Although, I mean, the Greeks believed that poetry should be spoken first and perhaps just spoken. But it went through a pretty dull period when, if you went to see a poet, you could perhaps view it as a time to have a nap and turn off. But we believe that poets should project, speak clearly, often without the text, and perhaps use props to make a point or to provide something else for the audience to think about.
So is this something you teach yourself, or is there a famous school of performance?
There's no school of performance poetry. I mean, everybody comes to it differently. I mean, there were a group of us, so we sort of sparked off each other. But I don't see poets doing what we did then now. The use of props seems to have gone away a bit, and perhaps that's good. If you look at the Forward Prize, which is the preeminent prize for poetry, which has always been written poetry, this year they gave a prize for performed poetry. And have a look at it. Search the Forward Prize, spoken word poet, and it's an extraordinary poem. But he has no props.
Well, props to him, as we say here. But the only props I think of are prop comedians. Did they ruin it for the prop poets?
Well, the lines blur. I mean, poets want to be musicians, they want to be actors, they want to be clowns. They often want to be anything other than a poet. But my poetry career has gone through the performance stage. I mean, the book we're thinking about today is not a performance poet's work, really. It's
I
more
would,
reflective.
well, you're going to be talking about a book of poetry that largely deals with your adventure with prostate cancer. I think a chainsaw could have worked for you. What do you think?
Yeah. Howard Kinniston was my surgeon, and that was before robotics. I think even he couldn't have manipulated a chainsaw successfully for that one.
Well, okay, we've established that there's no school for performance poets. Is there a living to be made, or is this more of a side?
No, absolutely not. There's no living to be made from poetry unless you're pretty exceptional. The poet laureate in Britain is Simon Armitage. He manages to get by quite nicely on it, but very few poets can actually make a decent living.
Well,
Actually, being a poet.
if I can maybe overstep my bounds, and maybe Bill and Mark would allow me to dub you the poet laureate of prostate cancer. Would you accept that honor?
Yes. Yeah. Well, the poet I
we've
most admired was an American, Robert Lowell. I thought his poetry was brilliant, and he was by no stretch of the imagination a performance poet.
But did he have prostate cancer?
No, not to my knowledge.
So we
He
would
didn't
give
live
it
to a
to
ripe
you.
old age.
You're at least the best living prostate poet. But
Yeah, I'll take the accolade, Howard. I'll take the accolade.
so what do you do to support your poetry?
I'm an architect
Still.
and a health architect, actually, although that part of my life is over now. But I worked in health architecture for most of my career, designing hospitals and theaters and burns units.
Operating theaters for the American.
Operating theaters, absolutely.
Yeah, interesting. So I'm sure your
So it was nice to be on the receiving end of something that I'd seen from the other side as a patient.
I read your poems. It sounded like the facility where you were treated was not exactly brand spanking new. It sounded like a big cancer ward
there's a poem there which refers to a very old hospital. I lived for many years, 30 years in Cardiff, which is the capital of Wales, and that's where I worked. And the estate, the hospital estate in Wales and indeed Britain, has been gradually deteriorating. And my son was treated in a dilapidated hospital, which I sort of refer to obliquely. But I actually, my procedure was carried out in a very good hospital, which is the University Hospital of Wales, Cardiff, by, as I said before, one of the preeminent surgeons in prostate cancer.
So, okay. So how old are you now, and how old?
74. I'm 74 now.
Oh, you're a young fellow. Okay.
How old are you, Howard?
I'm very much your senior, and I expect to be treated with respect. I'm 76.
Oh, you're only sneaking ahead. You're only sneaking ahead.
But I have to tell you, I feel 16 going on 17. So.
Oh, don't. I'm the same.
Not in all ways, but in many ways. Okay. But
yeah.
So, in what year were you diagnosed?
I was diagnosed in 2005 when I joined the.
That was the year your book of poetry was published too, I think.
Was it 206, 205, somewhere around there? Where are we?
Well, I saw 205 in the book.
Well, it must have been. I must have been diagnosed 204 then, I suppose.
Well, I hate to question a guest, but
oh yes, no, you're right. This was published in 2005, so I must have been diagnosed a year, or perhaps 2 years before.
Well, it was interesting. There were cookie crumbs in the book that set the year, because you mentioned, I think more than once, Timothy McVeigh, the
Yes,
American terrorist. I don't know
yes.
why he would have been on your mind unless he was about to be executed. Maybe you were comparing him to yourself, both getting strapped up
Well,
to I.
yeah, McVeigh has always intrigued me. I mean, there was he getting his lethal injection in on a gurney. I was intrigued by the man and his life being taken away when I was trying to save mine, I suppose.
Well, I think
So
there might have been sort of a parallel irony there, because his execution was medicalized.
yes,
They had
yes,
the accoutrements of
yeah,
of your surgery,
yeah. Yeah, yeah,
transportation.
indeed. And the makeup of the lethal injection was quite interesting with curare, and I can't remember now, but I was quite interested in the sort of technicalities of killing somebody and what
Well,
actually
I hope you
happened.
weren't contemplating applying those. It was just a morbid
Never,
curiosity.
never. No, 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 no. Uh,
Okay, so we think you got that. Well, you mentioned De Niro in the book,
yes,
and
yes. De
Robert De
Niro was,
Niro, he was treated here in Chicago by a prostate whisperer at Northwestern University, where I taught, by the way, but I didn't do
oh, really?
surgery.
Really?
I didn't
Yeah,
do
really?
surgery. Yeah.
Yeah.
I taught there for about 10 years in the School of Journalism, graduate school.
Oh, wow.
Uh, yep. Leading people to unfortunate careers where they will never make any money.
Oh,
So
well, it's poetry again.
it's a form of poetry. It's just not poetic very often. There's some poets in those ranks.
Oh, hats off to journalists. Hats off to journalists.
Well, I've been one for more than 50 years.
You know, a poet will take ages to write 3 lines, whereas a journalist can knock you out 1,000 words in half an hour.
You got that right, brother.
Yeah.
But now De Niro, I think you watched De Niro on TV and you mentioned him. And I think I think he had surgery in 2001.
Did
So,
he?
yeah, I'm pretty, we don't have to hold each other to these years because, as you know, you have poetic license. So we can do
Yes.
whatever we want.
I can say what I like.
Yeah. At any rate, but the point is you got diagnosed. And in
Yeah,
fact,
I joined the survey. There was a nationwide survey run by Jenny uh, uh,
Freddie Hamdi,
and Freddie,
yeah,
Jenny
well,
and
we
Freddie.
should explain who they are. Freddie Hamdi, and I met him in 2017 at a major medical meeting where I was the first patient they had invited to speak. And they forgot me on the stage, and I wrote about that. They gave me a gift in an unfortunate second or third career becoming an advocate because the optics were all wrong. But he was sitting next to me, and that's how I met him. But he and Jenny Donovan were the lead principal researchers on what's called a PROTECT trial with a capital T on the end and a
Yeah,
capital.
yeah, I'm well familiar
So
with.
tell you, well, but the people listening may not be, but the
Yes,
ASPI
yes, yes, of course, yeah.
the ASPI group is going to be giving an award to to the PROTECT team, and
Oh,
specific,
brilliant.
and then
Well deserved.
we think so too. I mean, because of people like you, uh, you might not have gone on active surveillance, what we call active surveillance, but they needed you and people like you to prove the safety of active surveillance. And in the end, it turned out that going on active surveillance was just as safe as having surgery or radiation. And which led people like me to say, well, what do I need with surgery or radiation if it all comes out the same in the end?
Absolutely.
So as we would say to the military here, thank you for your service, Ivor. But tell us how you got into the the study. You said there was a survey. Are you saying they sent out?
Yeah, the survey. So it occurred in some major cities throughout Britain, Newcastle, Bristol, and where I lived, Cardiff. And men were selected for asked to volunteer for this trial, which I did. My PSA was quite high. That resulted in me having a biopsy, and the biopsy identified, I think it says in the book somewhere, I can't remember now, 7 or 8 cancerous sites.
You realize that, and again, don't take this personally, but I believe you were a Gleason 7.
Yes.
But you don't know, and we don't know if you were a 3+4 or a 4+3.
No.
But
I don't even know the significance of what you're saying there.
Well, yeah, well, some of the people listening will, because
Yes.
many of those people are on active surveillance, and they're being watched. And they could be watched for many years. And there's a big difference between a 3+4 and a 4+3. 3+4, definitely you could go on active surveillance, although in the United States, only about 25% of them do today. Although in the beloved state of Michigan, where I also used to live, it's 45% opt to go on surveillance. So
Really?
things have changed a lot since your
Yes.
days.
Yes.
But you wrote a poem called, which I love the title because you really nailed it. You were talking about the choices, and the title was Cut, Keep, or Burn. Cut,
People
keep, or
cook. We needed the alliteration there, Howard.
Oh,
Cut, keep, or cook, I think it was.
sorry. Yeah, I misspoke.
We're going to cook it, we're going to cut it, or you're going to keep it.
Well, spoken as a performance poet. You could, I could see you acting that out.
Yes.
But so, yeah, that's a brilliant title. I like the alliteration, although I screwed it up, and you'll never forgive me.
No, you're forgiven.
But what actually happened with you? Were you were randomized and put into?
Yeah, of course. Yeah, or the trial, you were randomized. I was identified for I think radiotherapy, but I saw radiotherapy then, perhaps it's changed a lot now, as being something of a black art. I didn't think that the evidence at that time demonstrated a great success rate. So I sort of opted out effectively of the trial then and opted for a radical prostatectomy.
Were you, wait a minute, so you left the trial, or were you able to stay?
Well, no, they kept me on board, and everything followed as if I'd been randomly selected to have surgery. So I suppose the stats were sort of tilted a bit to allow me to proceed in the project, in the study, but make my own choice as to
I see.
what treatment I preferred.
So, how did that go, and how has it gone long term? Did you have any side effects as a result of, and we're big boys.
Well, you know, there's sort of. Oh yeah, I'm completely frank about everything. I mean, as Howard Kinniston did his ward round the night before, he came up to my bed and he said, "You'll never have an erection again without Viagra." And I thought, Christ, that's a bit of a shock. Um, but I proceeded, and Viagra does do the, or Cialis, or similar, does do the trick. But now I'm getting to 74. That's becoming a little bit more difficult. But I don't know the counterfactual. I mean, I don't know how well 74-year-olds manage anyway. So
well, the number as you get older, the numbers get worse and worse, and a lot of the doctors. Actually, we're going to be doing a program on this in a couple of weeks. Maybe you want to join us. We're going to have we'll put you on our list.
Yes.
Is the poet laureate, and we're going to have a urologist who's sort of an expert in this area, and he says, you know, the older you are, the worse it gets, and one of the problems is a lot of these doctors don't evaluate men in terms of their sexual status before the surgery. So there's a tendency, especially for guys who've had surgery, to blame the situation not on their age, which is sort of a natural thing, but to blame it on the surgery. So, but it's and remind me, how old were you when he was telling you this?
In 2005, 2004, I was 55. Johnny Ramone died of prostate cancer when he was 55.
So do you identify with Joey Ramone?
I was identified with Johnny Ramone. I didn't want to go his way. I did like
well, Frank Zappa too. A lot of poets. Elton John. The list is long. But you know,
really?
you could have, and I have to tell you, even back then, I don't know if you realize this, but many Gleason 7 men were going on active surveillance even then.
Yeah.
But I don't know if you're a 4+3, which is a little bit more dire a situation.
Yeah.
But overall, were you satisfied? Well, wrong verb. Were you okay with having this experience? Do you feel that it saved your life?
Oh, absolutely. I mean, you know, you only get one shot. You never quite know what would have happened otherwise. All I know is that I'm not dead. I run a dozen marathons every year. I'm pretty fit, and I got a book out of it. So, you know, pretty good result.
Well, let me ask you, what led you to write the book of poetry on this? And, and I have to tell you that Doctors Donovan and Hamdi, they were very touched by the fact that we were giving them this award. They said that it's very unusual, for doctors like them to get this kind of feedback from the patients that they helped. And then they mentioned you. I don't know that it is poetry. I don't know if it's a song to prostate surgery, but why
Yes.
I mean, it's gritty, it's real.
And I was a bit sort of resentful that it wasn't all milk and honey. I say, heads you win, tails I lose. I felt I was on the end of a pretty shitty stick here. So, I look back now, and as I said, you just carry on your life, don't you? And you make the best of it. And my life's been pretty good since. And perhaps I could have died. Perhaps I needn't have had the surgery. But it doesn't really pay to spend too much time reflecting on decisions made, I think.
Well, as the racetrack poets would say, woulda, coulda, shoulda. So
Yeah.
it is
Yeah.
what it
But I,
is.
you know, the genetic point is one to bear in mind, isn't it? My son, if my son has is diagnosed with prostate cancer, what is the advice I give him?
I
And now, talking to you, gentlemen, I think I might be a bit more circumspect about the advice I would give him.
Well, we hope so. I mean, we're not against treatment if you need it. And the fact that you got diagnosed at 54 put you in maybe a slightly higher risk, or at least a risk for genetic issues. For some
Yeah,
reason in Europe, they're not as they don't emphasize the genetic component of this as much as they do in the US.
yeah,
And
yeah.
and so I wondered, did
I
your
mean,
father or grandfather have prostate cancer?
no, I was just going to say that. I mean, my father was never diagnosed with prostate cancer, but I mean, he had huge urinary problem. I mean, died of Parkinson's when he was 75. But the preceding years were plagued by he was up all the time. You know, he couldn't go out of the door without planning where the toilets were. So, you know, I imagine he had, at the very least, an enlarged prostate, and perhaps he
Right.
did
Well,
have prostate cancer. I don't know.
it's important to emphasize that that's a separate issue. The British press can't seem to get it straight. But you know, you don't have to look very far to find an article in Britain talking about the symptoms of prostate cancer, which there really are no symptoms. Uh, you know, they bring up all these lower urinary tract
Yes.
issues, like frequent urination, and most of those things have to do with BPH. Now, in your poems, you talk about seeing a Chinese herbal doctor, Dr. Zhang.
Yes, yes.
Was that
Um,
was that a what we call a Hail Mary? Where you
yes. Well, I told you about you know, the thoughts about erectile dysfunction. So I just wondered whether the Chinese guy would have some magic potion here, which would
I guarantee you they do.
ensure full vigor.
Well, you could probably buy it, and you shouldn't. I know that they sell them illegally in Chinatown in Chicago, but
All
no,
right.
you can buy like rhinoceros horn, things like that.
I wouldn't be going there. No.
So it sounds like uh, that's not your thing. Now, you mentioned twice, at least in the book, Sister Vivian, and I have
Oh,
no
no,
idea.
there's no. I mean, um, I've sort of got the words of Leonard Cohen in my mind. He sort of talks about the Sisters of Mercy, doesn't he?
Ah,
And in some very evocative songs, but a song. But I mean, there's no mystery really. Sister Vivienne was the she was new to the trial. She came in to assist on the trial, so she joined in the diagnosis of patients. She was very caring. I mean, she was the first person I saw when I came round from the surgery. Although, having said that, I did opt for an epidural, so I wasn't actually unconscious. But she was there by the bed when I got back to
so
the
was
ward.
she was your Sister of Mercy, I guess.
She was my Sister of Mercy, perhaps.
I wasn't sure in the context, if you were, especially the first mention, if you were talking about an actual sister of yours, but
No,
she
no,
was.
she wasn't an actual sister. And she was quite brusque as well, which I think I captured in one of the poems. You know, she didn't have a lot of spare sympathy, which I prefer really. I prefer people to be a little bit on the how should we say, an unfiltered side. So I quite like that aspect of her.
Now you wrote another book called The Old Surgery. Did that have anything
No,
to
no,
do?
you've got the wrong end of the stick there, Howard. That's the publisher's address. The Parthian, the
Oh,
publisher, published out of the Old Surgery. I mean, I have written other books.
yeah,
Um,
I thought it was in a list of books there.
yeah, yeah.
I must have.
I'll send you
Oh, I
Ivan.
see. The Old Surgery. I got it.
Yeah, yeah. That's
So
where the publisher as publisher's address.
I got it.
I've got a biog somewhere, a literary biog. I'll push that through to you after.
Have you, since you finished up and you published the book, have you ever written about your prostate again?
No,
You were done.
done with it. Yeah,
Yeah.
yeah. There's a famous writer called Lowell who wrote Under the Volcano, and he was a drunk and a reprobate. But his job, the job of the writer, is to keep writing, and whatever happens to you, nothing bad can happen to a writer because it's all grist to the writer's mill.
Yeah.
So it's that sort of approach, really. It was good material, and I quite enjoyed writing the book, and it did get quite a good reception.
Yeah. Did you reach the prostate cancer audience? Was there any?
Well, yeah, I went to perform the poems to the group. They had a big meeting. This is going back many years now. So clearly, after I'd had the procedure and after I'd written the book, Freddie asked me to go and read the book to the research group and patients. And Howard Kinison, the surgeon, was there. And I remarked on the picture on the front is my stomach with the staples in from the surgery.
I wondered about that.
And I remarked at how untidy the surgery was. And he said that was his registrar. His registrar was useless, and he did the cutting open and the stitching up. And Mr. Brown, I think his name was. I can't remember, but it was a bit of a joke on that occasion.
Well, you look sort of like an uneven American football.
Yes, it's that. Somebody said yes.
Uneven. So we've been doing a bunch of talking. I don't know if Bill or Mark, if Mark's still awake.
He's moved outside, so it's good.
Oh, so I don't know if they have some questions, but I'd like to, with your permission, have you recite a couple of the poems.
Yeah, you stipulate what you'd like, Howard, and I'll give it a go.
I would love to hear some of your poems too. And you, like I was diagnosed in 2005, and so I've been on active surveillance for 20 years, and that was quite a challenge back then because I didn't even know anybody that was on active surveillance at that time. Well, I knew one person, but I really enjoy your lighthearted manner. This prostate cancer, you're a great testament.
Yeah, well,
for prostate. I mean, you've, and this is one of our things about active surveillance. We want you to thrive on active surveillance and prostate cancer. We want you to have a full life on prostate cancer, and you've done that even with treatment. You've done that, to your credit.
You're still part of our brotherhood, Ifor. You're still part of it.
Some men,
honorary member now.
Well, but you're the poet laureate. You're the poet laureate for. But
I turned down my watchful waiting, as it was then called.
Yeah, well, I wanted to ask you if you did if when you read, you could do a kind of a more performance-oriented thing that you might have done for Hamdi and his group way back then. I don't know whether you're able to do that now, but rather than just
pull out your chainsaw, please.
Yeah. Well, as I said to you earlier, Howard, this book is not of the performance type, so it's not my old performance stuff.
Yeah, I gotcha. I was just
it's a bit more reflective, I think.
I wrote you a note, and then didn't write down I suggested about 3 poems.
Yeah, you did. I was just going to look at my phone to see, but I think you suggested.
I suggested, this is from memory, Prognosis, the Cut, Keep, or Hook.
Yes.
Maybe the Prognosis. I can't remember. I'd have to look in.
Oh, Rust, I think, was suggested.
Yeah, Rust is very short, but I think anybody who's had a biopsy could identify with that, you know?
Yes, yes. And one of the reviewers, when he was reviewing this book, he said it was quite good because the machinery of life was sort of closing down. The machinery was broken. The machinery was rusty. And so the semen stained with blood, which made it rusty, was a sort of metaphor for the machinery of the body being broken.
By the way, I should ask, your title is Body Beautiful.
Yeah.
So what does that mean? Is that a takeoff on Walt Whitman, maybe, or?
Well, it's very kind of you to say that, but I have to say, I mean, it just struck me. I mean, you know, after surgery, you've got a cannula on each wrist. You've got staples down your stomach. You've got a wound drain, which is tube coming out of the wound. And I thought I was sort of adorned like a sort of South American warrior or something, with sort of body piercings and ferocious things through my nose or something, you know. So I thought I looked sort of like a warrior with all these medical accoutrements attached to me. And I thought that's quite beautiful. So I thought I'd achieved a sort of beautiful body post-surgery by all these medical attachments.
So